Welcome to this training video on reducing emergency department violence, focusing on verbal de-escalation techniques to address difficult scenarios that may present in the emergency department, especially from patients suffering from mental instability. Please take time to focus on the key elements of this video and enjoy. Before we begin, please pause the video, take a screenshot, and use the QR code to access the pre-assessment module. Your response to the assessment will be crucial in determining the effectiveness of this de-escalation training video, and will help in improving and developing training programs aimed at supporting ED staff in difficult scenarios that can happen in the workplace. With the incidence of violence in ED on the rise, we must be prepared to deal with patients, especially the ones suffering from mental illness. This short-form video training module will focus on verbal strategies that emergency department staff can use in de-escalating different levels of aggression associated with mental instability. Let us first try to understand the mental health status of patients presenting in ED. The flowchart illustrates the progression from a stable mental health state through stages of agitation, aggression, and potential violence, culminating in a mental health crisis. De-escalation and professional support are crucial interventions at every stage, aiming to prevent further escalation and guide the patient back towards a stable state and normal functioning. By addressing triggers and unmanaged behaviors early, de-escalation can mitigate heightened hostility and impulsivity, ultimately reducing the risk of harm and avoiding a full mental health crisis. We now move on to the next topic, which is verbal de-escalation techniques. A general unpleasant scenario will be presented between a patient and an ED staff, after which, different communication techniques will be utilized to de-escalate the situation and diffuse tension between the patient and the ED staff. Meet Nurse Jane. She is on the 9th hour of her shift on a busy night when a mentally unstable patient suddenly becomes aggressive. Let's play out the scenario.
Why the hell am I stuck here? You people are trapping me.
Sir, you need to calm down right now or we'll have to restrain you.
Don't tell me to calm down. You're all against me, I know it.
Stop yelling. You're making this harder for everyone.
You're not listening. I'm freaking out and you don't care.
If you don't cooperate, we'll call security. Just sit down.
In the previous scenario, Nurse Jane had no control of the situation and is aggravating the patient's mental state by arguing and not listening. The next scenarios will explore verbal techniques to de-escalate the situation and help the patient come back to a more stable state of mind. We will be exploring 4 techniques and will be presented as we go along. The first technique is trying to avoid being rigid, antagonistic, and avoiding contrapositions. Please listen on how Nurse Jane should have communicated to the patient using this technique.
Why the hell am I stuck here? You people are trapping me.
I can see you're really upset. Let's take a moment to figure this out together.
Don't tell me to calm down. You're all against me, I know it.
I'm here to help you, not against you. Can you tell me what's making you feel this way?
You're not listening. I'm freaking out and you don't care.
I'm sorry you feel that way. Let's sit down and work on this step by step. How does that sound?
Notice that the focus of this technique is more about how you communicate in a flexible and non-confrontational manner. Adaptability while avoiding challenges and argument are key elements of this de-escalation communication technique. The second technique focuses on minimizing conflict. Please listen on how Nurse Jane should have communicated to the patient using this technique.
Why the hell am I stuck here? You people are trapping me.
I hear you're feeling trapped. Let's sit and talk about it calmly.
Don't tell me to calm down. You're all against me, I know it.
I'm here to help, not to oppose you. What's on your mind?
You're not listening. I'm freaking out and you don't care.
I'm sorry you feel that way. Let's take it slow. Can we sit and address this together?
There may be similarities between the second and first techniques. However, notice that the focus of the second technique is more about the desired outcome and the broader strategies employed to achieve it, together with prioritizing patient safety. Shifting the focus away from the source of the conflict to a more neutral or productive topic or action is key in this de-escalation communication technique. For the third technique, finding a common ground is essential in de-escalating a difficult situation. Please listen on how Nurse Jane should have communicated to the patient using this technique.
Why the hell am I stuck here? You people are trapping me.
I can hear you're feeling frustrated, and I want to help. Would you like to talk about it here or in a quieter space?
Don't tell me to calm down. You're all against me, I know it.
It sounds like you're really scared, and I agree we both want you to feel safer. What can I do to support you?
You're not listening. I'm freaking out and you don't care.
I'm sorry you feel unheard. I do care. Let's work together. Would sitting and breathing slowly help us start?
For the third technique, notice how active listening and acknowledgement are used to guide the conversation. Paying attention to suggestions and questions, and addressing them, validates the patient's concerns, avoiding further confrontation. Moreover, patience and persistence are essential characteristics in trying to gain cooperation from a combative patient. For the fourth technique, approaching the situation without judgment can help diffuse a difficult situation. Please listen on how Nurse Jane should have communicated to the patient using this technique.
Why the hell am I stuck here? You people are trapping me.
I'm curious, what feels trapping to you right now? Let's explore that together.
Don't tell me to calm down. You're all against me, I know it.
I'm not here to judge that feeling. Could there be something specific making you think that?
You're not listening. I'm freaking out and you don't care.
I hear your frustration, and I want to support you. Maybe we can try something different. What might help you feel safer?
For the fourth technique, notice how handling the situation without preconceived notions or rigid expectations helped guide the conversation. In practicing this technique, you need to be flexible and adaptable in your outlook to keep your mind open to all possibilities. Moreover, having no fixed ideas about what will happen or the cause of difficulties allows for a more versatile and effective approach when responding to a confrontational patient. With the rising incidence of violence in emergency departments, mastering verbal de-escalation techniques is crucial to manage patients with mental health issues effectively. Techniques such as avoiding rigidity, minimizing conflict, and fostering collaboration, demonstrated in scenarios with Nurse Jane, help address underlying needs like fear or loss of control, preventing escalation to aggression or violence, and guiding patients back to a stable state of mind. By maintaining an open mind and offering support, healthcare professionals can create a safer environment for both patients and staff. As we approach the end of this training, please pause the video, take a screenshot, and use the QR code to access the post-assessment module. Your response to the assessment will be crucial in determining the effectiveness of this de-escalation training video, and will help in improving and developing training programs aimed at supporting ED staff in difficult scenarios that can happen in the workplace. And so, by mastering verbal de-escalation, we empower ourselves to transform challenging situations into opportunities for connection and safety, ultimately fostering a more compassionate and effective emergency department for both patients and staff. Thank you for your time. Check out the references if you are interested in further readings. This video presentation is part of a 3-tiered education campaign together with an interactive academic poster that will be displayed in the department and a proposed hands-on simulation training involving all ED staff and stakeholders. A sample simulation training on de-escalation procedures can be accessed via the QR code on your screen.